1 minute to go.
20 seconds.
You found it? Okay. Jean? Supervisor Bishop?
Okay.
Okay, I'd like to call this special board meeting to order. Could I have the clerk do a roll call for those on the telephone, please?
Supervisor Angus?
Here.
Supervisor Johnson?
Here.
Supervisor Gould?
Here.
We have a quorum.
Okay. I understand Supervisor Watson will not be here today, so we do have a quorum, and I'll turn this special meeting over to you, Denise.
Good afternoon, Madam Chair, members of the board. I'll start off the usual agenda by going through the numbers. We currently have 751 cases in the county, and that is a 19% increase over the previous week. And I just want you to be aware that 80% of those cases, so approximately 97 of those cases, were community acquired, so not acquired in a long-term care facility or not associated with any long-term care facilities. So we continue to see growth out in the community in cases and case numbers, and something that we need to address in some way, shape, or form through media or other methods to keep not just the public informed, but try to keep them educated on what steps they can take to prevent the spread and the transmission of COVID. Hospital capacity, I believe you all received that capacity report. We did add a couple of lines to that so that you can see the positive admissions per day. And then we explained the emergency department to be more clear when we said ED, what that actually meant. But anyway, so you're going to see, and let's see, I thought we also had one other one, but I think we're looking at positive admissions per day, just so you have an idea of the number of people that are being admitted into the hospitals per day. It doesn't speak to the number of days that they stay or how long they have a stay, but it does give you an indication of the number of cases that are being admitted into the hospitals. So, any questions on numbers and hospital capacity so far?
I have a question, Madam Chair.
Yes, go ahead, Supervisor Johnson.
You might have created your own problem by giving us more information. But I noticed they did take out the number of inpatient beds. Can that be added back in?
It can be, yes. I'm sorry, I didn't see that. So yes, we can add that back in, I believe. Yes.
All right, and then is it possible to be notified of how many inpatient beds are for COVID? And also how many, I guess that would be it.
We'll look into that for you, Supervisor Johnson, and we'll add those in if that's available to us. Oh, I believe Melissa has the answer.
On the COVID report you send us daily, I've noticed the numbers have been off for a while now. This report is done by our own health department. So are we getting the numbers back up to where they should be?
I'm sorry, Supervisor Johnson. The assistant director was going through the hospital capacity report question with me real quick to point out, if you wouldn't mind if I could just circle back to that real quick.
Sure.
So the number of ICU beds in use by COVID-19 patients, is that the information that you're looking for in addition to the number of, because that remains in the report still?
Okay. I guess they're the only questions I have then.
Okay.
Madam Chairman?
Yes, go ahead.
Denise, I was just wondering what is the number of recovered for this week?
Yes, and thank you. I meant to touch base with our person who updates our website, and she was busy in a meeting. So the number of recovered cases this week is 348.
Thank you, ma'am.
We'll update that website as soon as possible.
Madam
Supervisor Angus, go ahead.
Denise, of those who were recovered, are we keeping track of the length, how long it's been how long it took and like that, just for, for future reference on the disease itself.
Supervisor Angus, you're difficult to understand. You're kind of
It kind of broke in and
Oh,
out.
like I was on this. Is this better?
Yes.
Okay, sorry about that. So on the tracking of the people who have recovered, are we putting down, or is there some kind of note of how long it's taken people to recover?
That's a
So
good...
we have some kind of for future, for data.
Right. I'm not certain if we're collecting that information, Supervisor Angus, but I'll follow up on that.
Because it would be interesting, I think people, because there's so much fear of the unknown, that if you get it, most people do recover, and it would just be nice to know, in general, some of the recovery times for different sectors, like a healthy young person or a middle-aged, with some underlying, things like that.
Sure. Yeah, no, I definitely understand where you're going with that. So we'll look into whether or not we can provide that and what kind of information we can gather for you, okay?
Right, and I don't expect you to do every one of them, but just sort of as a,
Sort of sample?
as a percentage, or examples and stuff.
Okay.
Most notably, what I'm interested in is the infants.
So the infants in terms of their recovery rates? Or how quickly?
We know, what is the time of recovery?
So, and if they're positive, they fall under the same guidelines of at least 10 days, symptom-free or with improved symptoms, 3 days with no fever, without medication. So it's a minimum of 10 days, but I understand where you're coming from, so I'll look into that.
Okay, and I think we talked about this last time, but if you look at the whole state, we are still pretty much on the lower side of positive cases per county. Did we find out why other counties are testing much more than we are? Is it that people aren't requesting it as much? Is it easier to get? Have we figured any of that out?
Yes, Supervisor Angus. There are additional testing sites in most of the other counties, so, and they're actually listed by zip code through the ADHS website. And I think that ease of finding a location that will test makes it a little easier for people, of course, to go and find that testing. We did learn about another testing site in our county, and that's the CVS in Fort Mojave. And they are doing testing over in that location. And we are working with ADHS to look at how we can expand testing in Mojave County at different sites, beyond just the hospitals.
At the CVS in Fort Mojave, can you just walk in, or do you have to have symptoms?
I believe, I'll have to look that up. I'm sorry, I don't have that information right off the top of my head.
Okay. I'll figure it out, too, because I think people would want to know. You probably have to make appointments. You don't want a lot of sick people just sitting there at CVS.
Absolutely. And we will, if given permission, add that information to our website, so it's available for people to check on our website as well.
Thank you very much.
Okay. Any other questions?
Yes, Madam Chair.
Supervisor Johnson.
Director Burley, is the amount of young people getting it, especially from 0 to 10, is that concerning?
It is concerning, and I think that it just goes to the fact that we're seeing individuals within families. You'll have a family member that may have mild symptoms or may not realize that they're positive, and that virus is being shared within the household, and that is concerning that we see younger kids affected. And at one point, it wasn't really thought that the kids had sort of the adverse and more severe symptoms, but I don't think that is the general consensus at the time.
Another thing that's concerning to me, you and I talked about it last week, is the time it's taking to get the tests back. Now, it could have been, one person that took over a week to get their test results back. Just this morning, talked to another person who relayed that it's been 5 days. This person has a hard time even getting up and walking across the room with breathing. Have we found anything out about why it's taking so long to get test results back? Because I imagine that really screws up your tracing when it's over a week late for getting the results.
Sure. Yes, absolutely, Supervisor Johnson. We did learn that some of the labs are reaching capacity for their testing due to just the sheer number of tests being performed each day and each week. And ADHS is looking for strategies to try to increase that capacity. Number of labs potentially that are available to test and so on. So they are looking for some answers, but that number of days has increased. That time frame for receiving results has increased for some. That isn't to say that all of them are like that, but definitely some labs are feeling strained.
Thank you.
Okay, Denise, you may be planning on going over this, but if you're not, can you explain what we've done to educate the public on the seriousness of this COVID-19 virus?
Sure, absolutely. I think we've used our website primarily for these messages, and we have worked with our communication director to try to expand that messaging out to other mediums. And we actually are having conversations about continuing that effort to inform the public and educate them on the importance of the preventive measures and the seriousness of the virus itself. So that process is in motion.
Okay, good. Because I think it's important that people understand that it's not just the elderly or the older citizens that's being affected by this. It's all ages, and of specific concern is the people in the age group, 20, 30-year-olds that are getting this virus.
Right.
Okay.
Okay. All right. Okay, we do have some services that have been affected by by COVID, and primarily that would be our senior services and our Meals on Wheels program, congregate meals. And in light of that, we have been in contact with WACOG about the program and expectations moving forward about service delivery. And in those cases, they've provided a phased reopening guide for programs to review. And essentially what they've said is that they believe that they've authorized the health department and the county to make those decisions until in the best interest of the clients and customers and the staff. And so we have provided services so far through the Meals on Wheels program, where we've delivered those home meals, and then also done drive-through congregate meal provisions. And that way we have minimal contact with both the staff person and the client. We'd like to continue those operations until we start seeing a leveling off or decrease in cases, and until we feel it is safe to do so for all involved. And we know that's a vulnerable population, and we need to be very careful and mindful of how we provide services to that group with a continued spread of the virus. The other program affected by that is the state WIC program, or our WIC program. We are looking at continuing to provide services in more by phone and other means through Zoom. And the state WIC program itself is asking for an extension until August 1 to continue those services in that manner, and we are waiting approval of those services in that process. That hasn't been, at this point, starting July 1, we would go back to providing services the way we would normally provide them, but the state WIC has asked for that exemption again and that waiver, and so we're just waiting for that reply.
Another question, Madam Chair.
Yes, go ahead, Supervisor.
You said the WACOG gave the discretion to the County Board of Supervisors, and it kind of sounds like you might be asking us to continue the service level that we had prior to today, on, because the board has said that they want everything open again. What confuses me is there was an article in the paper in Lake Havasu today saying that the Havasu Senior Center is going to continue with the shutdown and delivering the meals in the way they were previously without approval from the board. Can you explain that?
I can, and I have made staff aware that prior to speaking with the media, I'd need to know what those questions would be, and then if need be, that I would be the one to respond to those questions. But additionally, and I need to apologize, Supervisor Johnson, because I was not honestly aware of this being a board decision. We've been asked to try to modify some of our services along the way, and I didn't know that this would need to come before the board for a decision. So if that's the case, yes, I am asking if we can continue to provide the services the way we do now, which is under COVID-related structure, until further notice when we start seeing a decline in cases.
Okay, I believe that was in our pandemic annex. That was where that was located, and it said that the county manager or the board of supervisors could do it, but I just feel that the board should be notified of these things prior to decisions being made.
Okay. We can certainly do that for you, Supervisor Johnson.
All right, thank you.
Certainly. So county building signage and masks, we're working to develop some language for signs on county buildings that strongly encourages the use of face coverings and masks while in the building getting services. We do have approximately 1,000 cloth masks that we can provide to the security desk here and in other areas and other buildings for staff to distribute to the public as they come in. So we're working on that, and hopefully we can have some language completed and drafted possibly by the end of today. I might be overstretching that just a little bit, but we'll get that completed as quickly as possible and work with facilities to get those signs created. We'd like them to be professional looking, and so we'll work with that group to ensure that they are. Any questions on signage and masks in the county building?
Okay, any questions? Don't think so. Thank you.
Okay. I don't actually have anything specific on my agenda beyond that, but I'd be happy to answer any questions.
Does any supervisors have any questions for Denise?
One last one, Madam Chair.
Okay, go ahead.
I think we might have misunderstood each other when we were talking about inpatient beds in the report. I think they took out the available bed.
Okay, total number of inpatient available beds, is that the one you're looking for?
Well, they used to say inpatient, ICU.
Mm-hmm. Okay. We'll look at past reports and see if there was something that was omitted in lieu of some of the other things that were added, and we'll add that back in.
Thank you.
Okay.
Okay, no other questions. So we'll go on to the next item. This will be a discussion of possible action. Ray, approve the use of Coronavirus Aid Relief Economic Security CARES Act funds to address staffing needs that will support the expansion of investigations to pay expenses for 6 months of temporary staff and cell phones needed that COVID-19 public health emergency preparedness funding will not cover until the ELC cooperative agreement is awarded, which then can be utilized to reimburse county for costs incurred. The maximum amount requested will be $577,142.55. So does anybody have any questions on this, or can I get a motion?
I have a question, Madam Chair.
Supervisor Johnson.
Director Brody, in your backup, you're asking for 17 positions, which will free up 14 positions that you currently have that will go back to their regular job. Now, you told me before, told the board that we had 41 people working on COVID. So now we're going to be raising that up to 44 people working on COVID?
Correct. Yes, we definitely need additional staff to continue working and to ensure that we're able to investigate cases quickly and to follow up with those cases afterwards. And we also...
Do you have a breakdown that you... Oh, good.
I'm sorry, I didn't mean to interrupt, Supervisor Johnson. Go ahead.
Oh, I just wondered if you could have a breakdown of what these 44 people job titles are. It just seems like that's an awful lot of people.
It is. And I don't disagree. We put it all up on a whiteboard. It took up the entire whiteboard by the time we had it all written out, and it probably didn't encompass everything, but most. And in many of those, it runs from working the warehouse to delivery of PPE, those nursing staff and other staff that are helping with investigations, contact tracing, delivery of medicine. Gosh, I don't have my picture. Hang on, I do have my picture. But we have a number of different areas that we are using these individuals for help. And it's taken a village, and it's been our department village, and emergency management, the community the communications director, county attorney, and many other departments have helped us along the way. But I didn't include all of those individuals. I really focused on both the health department staff and EM. But yes, I can provide you with an overview of what that looks like for each department, or for each area, if that's okay.
That would be great. I think that would help the board, and then especially with our contacts with the public when they are asking us questions about, what our workforce is and how involved we are. I think it shows the magnitude of the problem.
Sure.
Now, so far you've said that none of these cases have been put to, let's say, an event. We had a baseball game where everybody broke down. Are any of these community-related?
Do you mean specific to an event or an activity of some sort?
Right, whether it be a restaurant or a ball game or a senior prom or anything like that. But if it's just somebody's getting in the family and they keep it in the family, are we having any, or is it too much work to have a cluster saying, here's Supervisor Johnson got it, you got a little circle, and then a little arrow goes over here to somebody else that got it? Have we seen any spread like that?
Yeah. Yes, I believe we are seeing some cases similar to that. I do know that there have been businesses affected by this. And so in some cases, those businesses may had to reduce capacity and ability to serve people. And I think that's something that that we need to stress too, that by taking the needed steps to keep your employees healthy, we then keep these businesses moving strong. And so just kind of on another note, and things that we need to stress is as facilities have employees that get ill with the virus, it does put them out for a minimum of 10 days as employees, which takes them away from the workforce and the ability to provide services in that particular business.
Correct. Yeah, I think that's pretty important that we get that out. And that's the thing, too, that people don't understand is where that one person is out for so long, once they have recovered, then the other family members are 14 days still quarantined.
Right. Yeah. It's quite a net.
If nobody else has any questions, I'd make a motion to approve.
Have one last question. Did we see any kind of spread from the protests that were held in the various communities?
Not so far.
Okay,
Not so
great.
far. Nothing that we've been able to link directly back to that activity.
Great. Okay, so we do have a motion on the floor from Supervisor Johnson to approve. Do I have a second?
Second.
Okay, all those in favor signify by saying aye.
Aye.
Any opposed? Okay. Okay, motion passes. Thank you, Denise. Going on to the next item, this will be a discussion of possible action. Ray, approve the use of the Saguaro rooms in the County Administration Building by Vigilant to conduct a blood drive operation on July 27, 2020, with the requirement that all COVID-19 precautionary measures specified by the state of Arizona and internal procedures be implemented, including the mandatory wearing of masks by all room occupants, temperature checks, 6-foot social distancing, and continuous surface sanitizing. Hello, Byron. Does anybody have any questions? I do have Byron Stewart, our Emergency Management Director, at the podium. If not, I'll entertain a motion.
Madam Chairman,
Go ahead.
I move that item 3 be adopted.
Okay, do we have a second?
Second.
Okay, we have a motion and a second. All those in favor signify by stating aye.
Aye.
Any opposed? Motion passes. Thank you, Byron. Okay, next item, this will be a discussion of possible action, Ray, accept initial reimbursement funding from the FEMA COVID-19 Public Assistance Program and Arizona State matching funds for up to $36,921 and up to 90% of subsequent qualified county government expenditures for COVID-19 response and recovery, and designate the county manager, Sam Elters, as applicant agent for the financial assistance from the Arizona Department of Emergency and Military Affairs Division of Emergency Management for declared emergencies in the county, including pass-through funding for the COVID-19 Public Assistance Program. Any questions, comments? Do we have a motion?
Motion to approve.
We have a motion on the floor. Is there a second?
Second.
I have a motion and a second. All those in favor signify by stating aye.
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 Any opposed? Motion passes.
Thank you.
Okay, the next and final agenda item, number 5, this will be a discussion of possible action, Ray, authorize and accept Arizona Cares funding in the amount of $9,136,651. I have Coral Lloyd in the audience if there's any questions. Otherwise, I'll entertain a motion.
Madam Chair, motion
Madam
to
Chairman.
approve.
Okay, we have a motion from Supervisor Angus. Supervisor Gold, was that a second?
Second, because they'll just give it to somebody else if we don't take it.
Okay, we have a motion and a second. All those in favor signify by stating aye.
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 Any opposed? Motion passes. Meeting adjourned.